Yes, indeed. I mean, we use a similar drug, cefpodoxime, which is not actually very useful as a third-generation cephalosporin clinically, and any resistance to that alerts one to the possibility of an ESBL. There may be other mechanisms, but the key thing is it tells you don't use any third-generation cephalosporins and watch out and look at the quinolone susceptibility, which is invariably resistant. So you're absolutely right. It's primary early testing with a third-generation cephalosporin. That's the way to, I didn't show a slide because I kept it fairly clinical, this presentation, but you're absolutely right, early testing. And suspicion. The problems arise with the empirical therapy in a sense because you judge when does this patient ill enough or desperate enough that I must use a carbapenem, because you don't want to treat everyone in the ITU with a carbapenem because guess what? We're beginning to see some resistance. It was mentioned in the first presentation and we want to try and keep that resistance down. So it's how to moderate. And certainly early microbiology and early sensitivity testing allows you to de-escalate. So your net usage of drugs like carbapenems can be kept at a reasonable level. Otherwise, you just treat everyone with the same drug, and that we know is bad. Yeah. So very, very wise words. I would support them.
Something else. That is, if you look at the Britishers' view of tackling ICU infections and the Indian counterparts, we go for antibiotics with the broader spectrum. At the same time, the protocol base in the UK, as I gather from Dr. Hockey, is that they go with a very narrow spectrum. Going with a broad spectrum is always asking for trouble. But going on a narrow spectrum, you must be very confident that your microbiology department is capable of saving you from disaster. And the Indian ICUs, my good friend, the doctor from AstraZeneca, mentioned that he is a disciple of Camilla Rodriguez. See, he's been able to name one microbiologist in the whole of the country who is interested in intensive care. So just think about the other ITUs in the country. And that is a problem we are facing.